Hi, everybody. Today we're here with Dr. Andrew Kirschner. He has a solo practice in Bala Cynwyd, Pennsylvania. So obviously everyone's pretty aware of the COVID-19 pandemic and everything that has been happening um, globally and also specifically within the United States. So we're going to talk to Dr. Kirschner about what it's like to have a solo practice in the middle of COVID-19. So why don't we start by walk us through a little bit what it was like when PA first went under stay-at-home orders because of COVID-19. What was that like for you and your practice?
Well, fortunately, we were probably a little bit better prepared in my practice than some of the other practices. I had been speaking with some of my friends who are on the West Coast. I'd been speaking with some of my friends who've been in practice for a long time, and we kind of knew that this was coming. We didn't have a ton of warning. A lot of us who've been looking at it really thought that we had until like the summertime to get prepared. Came a little earlier than we thought, obviously. But my practice was mostly prepared, and we did the best we could to transition to primarily telemedicine once this hit the area.
And now that things are beginning to be allowed to open up and you're allowed to see people in person more, what is it like in for your in-office visits? So how have things changed? What would it be like if I were to walk in as a patient to your office?
Well, we would be screening you before you came into the office to make sure that you hadn't been really sick recently and that you hadn't had a fever, that you hadn't had any recent travel to any of the worrisome areas, like some of the states that are really experiencing a serious surge in their numbers. And once you were cleared for that, you'd have your temperature taken as soon as you walk through the door. You're wearing a mask for sure. I mean, nobody's even allowed through the door without a mask. I'm wearing a mask, a face shield. We are basically scheduling one patient per hour to leave me enough time to really wipe down everything in the office and do our best to make sure that all the surfaces are clean in between each patient. And, we're doing the best that we can.
Yeah. And I mean, you mentioned telemedicine and how um, practices have been using that even more so than they have in the past. And a lot of things obviously have changed with this. So, how do you see the impacts of COVID-19 on healthcare lasting long term, specifically for solo practices like yourself, but just in general in the healthcare world?
Well, by and large, it's going to really depend upon what our national response is, quite frankly. Right now, I mean, you mentioned that things are starting to open early. And I think they're really starting to open too early. And if we looked at the examples of some of the other states that have gone and tried to open things up, weeks or even a couple months ago, they're not faring well. And we've Pennsylvania, a lot of people have criticized Governor Wolf for taking a lot of the steps that he's taken to keep businesses closed and to keep people separated as best as they can. But the truth of the matter is, we've had a better set of numbers and a better set of statistics in a lot of our adjacent states. And there are people who are just not willing to take this pandemic seriously. So in terms of how it's going to affect me going forward, it's going to really depend on what happens to our numbers. I kind of anticipate there's going to be a pretty big surge in numbers, in the coming weeks, just because of them opening restaurants, even for outdoor dining. And so I anticipate telemedicine being a big piece of my practice for the foreseeable future. And frankly, I mean, I hate telemedicine. I'll do it because my patients need it, and people need it. But I love the personal interactions that I get when I actually meet with my patients. I'd like to shake someone's hand, and now you can't shake someone's hand. So how this pans out is going to really depend on whether we really take the steps needed to put down the pandemic.
And kind of jumping off of that, for everyone watching or just, for everyone's benefit, what are some of the most important things you would tell people about COVID-19 and the precautions they should be taking?
Well, the first thing I would tell you is take it seriously. I mean, there are unfortunately a fair number of patients and people out there who are taking this lightly. They're acting like it's just a cold or a flu, and it's not. It's not just a respiratory illness. It affects every aspect of your body. And even if you're somebody who doesn't get a bad infection, they're showing that even patients who are asymptomatic are actually having consequences on some of their organs, particularly the lungs. But the more worrisome thing is, and you're a younger person, and so with younger people, there's this thing, well, I'll be fine. But when you get this virus, you spread it to everybody that you've met. And your parents might not be fine, your grandparents might not be fine, and the people you work with might not be fine. So really it's incumbent upon you to really wear a mask. So that's, I know that there's this, politicization of the masks. Wear a mask. It's just, science doesn't care what political party you're in. Just wear a mask. It's not a complicated thing. It's something you can do to help yourself and the people around you, and to help make this thing a lot shorter than it would otherwise be. Obviously, things like hand washing. Obviously, things like if you do feel a little unwell, stay home. If you had a potential, exposure to somebody, stay home. Do the 14-day quarantine so you're not potentially spreading this around everybody. I mean, those are the biggies right now. Now, and I'll say one other thing. I have a lot of friends and patients and relatives in the restaurant industry and the food service industry. And it's really, of all the industries, they're getting just battered, because it's, a place where you go inside and there's 50 people sitting in the restaurant. I'm doing the best I can to support my local restaurants and the places that I like by doing takeout as much as I can. But now that they've opened restaurants for outdoor dining and some with indoor dining, the most important thing I can say is don't go. I'm going to get a lot of hate for saying this. Just don't go. Do takeout. Go get your favorite food. Eat it on your patio. Eat it in your dining room. But don't eat it in a room with people, even if you're 6 or 10 feet away. It's looking more and more like this virus is actually airborne, and it's just spread very easily. So just eat it at home.
Yeah. Well, thank you so much for that insight and for giving us a little bit more information about your practice specifically. Finally, for everybody watching, what's the best way for them to get in touch with you or your practice so that they can either learn more about you or set up an appointment?
You'll see the link to my website attached to this video, and our office number is 610-617-9355 or 617-WELL. You can reach Turquoise, my office manager there, and she will help set you up and get you in touch with us as quickly as possible.
Perfect. Thank you so much. And
I really appreciate you taking the time to interview me. Thank you.
Yeah, absolutely.
Wear a mask.
Wear a mask. Thank you.
Bye-bye.